Hi everyone, this is Greg Brand, GB Aesthetics from London. I am a facial plastic surgeon with a strong focus on aesthetic lip surgery. We all have seen the facial transition of Demi Moore's for this year's Fendi Fashion Show, and I had a look at her lips and I wanted to present you my thoughts on what might have been performed on her lips in order to change the appearance. Now, as a disclaimer, I do not know whoever treated Demi Moore. I am not affiliated with any of these doctors. Neither is Demi Moore my patient. This is just an educated guess to present some of the techniques that exist and possibly might have been used in order to change her appearance. We all think, well, if we look at these lips, they do look different. So did she or did she not have a lip lift? That's the big question. Before we start talking about that, I think it's worth exploring her lips from the very young age. This is a young Demi Moore in '92, and what we can see is she has a thin upper lip, fuller bottom lip, but rather horizontal lips. And as you see in the magnified picture of her lips, I always take a picture of the tip and the lips. The reason for that being is, as you see in this illustration with the green lines, I call it the TLC, the tip lip complex, the transition between the bottom of your tip across the columella, which is the piece of skin between your nostrils, and then the philtral columns, which are these two lines between the little central dip, which is the philtrum, and then transitioning to the vermilion border, which is the transition between the red and the skin portion of your lips, and equally the cupid's bow. So all this plays together, and as I will be speaking about Demi Moore's lips, bear in mind that this is how we should always look at lips, not just the vermilion, not just the fullness of the red lip portion, but equally the top lip, the bottom lip, the correlation to the nose, to the chin, to the cheeks. All this always plays in together, and this is what we call aesthetic balance. Now fast forward a couple of years, this is Demi Moore in the fashion show of Yves Saint Laurent in 2016. You already see there is quite some changes, more so in the skin texture. You see that the skin is a little bit less plump. There is something what we call crêpe skin, the beginning of some irregularities due to the lack of stability in the skin, which is absolutely normal in relation to the aging. One little thing that I want to point out is at the bottom of the vermilion border, so the transition between the red lip part of the lips to the skin, you see this kind of a ledge. And this could be an indicator for some filler product that has been placed and maybe even migrated. Filler migration always happens when too much product is placed into the lips. We have to think of the lips as an anatomical unit, pretty much like a glass. And if you keep pouring water into a glass, what happens? You spill. And equally with the lips, if you add too much product into the lips, it starts to migrate because the lips just can't hold that much product. In addition to that, we must keep in mind that lips are a dynamic organ. It's a muscle. So this product can actually be squeezed out of the area. So the glass, if we use the analogy of the glass, can actually get actively smaller. All this needs to be taken into consideration, and if we want to use dermal fillers to significantly improve and enhance the appearance of lips, we have to add in another factor, which is time. Small increments of injections and then spread out over time so that the tissue can adapt to it, and as the filler settles into the tissue, it then slowly and steadily can, to some degree only, but still can improve the volume. As I look at the picture of Demi Moore in 2016, it looks like she might have had some filler product placed into the bottom lip and then again creating this ledge as a proof of some minor filler migration. Fast forward to 19, you see again pretty similar lips, less crispy contours, so along the vermilion border there might have been some filler injection in 2017. But one thing that you also can see at the bottom lip of 2019 is more of this filler migrated and thereby reducing the overall sharpness of this ledge. Now fast forward to 2021, and if we compare these two lips, they look very different, and the presentation here aims to describe what I think might have been done in order to change the appearance of Demi Moore lips. Quick summary of the terminology that I will be using. As already mentioned, the columella is the piece of skin between our nostrils, and as you can see on the left picture, there are these two vertical lines, or slightly slanted lines, coming from the columella to the lips, and these are the philtral columns with the central dip, the philtrum. The red lip portion of the lips we call the vermilion, and the upper vermilion border depicts the Cupid's bow. On the right picture, you see some terminology that I'm using just for the sake of enhancing the understanding and keeping it simple. Anybody who's following Dr. Stephen Harris in London, who's a phenomenal injector, in particular for lips, I can only encourage you, follow him, because he's also highly educative in his content. He talks a lot about the tubercules. We have two tubercules, round bodies in our lips at the bottom, and one in the center of the top lip. For simplification of terminology, I use the analogy of a bird in the top lips, with the central tubercle being the body and the slanted vermilion on each side being the wing. This is the terminology I'll be using when describing her lips. Now, as already said, the first thing we need to look at, respecting the TLC, the tip-lip complex, is the transition between the bottom part of the tip towards the lips, and thereby the columella. And as you can see, the central dip, the central piece of skin that had a dip before Fendi, suddenly seems to be shorter. It seems to be horizontal to the degree that you can actually look into the nostrils. This is certainly a change that is apparent, and this is something I call columella loss. In some cases, in particular in rhinoplasty with patients with an excessive hanging columella, there are techniques how we can correct it. Usually in primary cases, this is due to a hyperplasia or elongated septum, which is the wall separating the nostrils. And in these cases, you shorten the caudal edge of the septum and you bring the cartilages up a little bit to shorten the amount that you can see of the columella in side profile. However, if you do this too aggressive, then you can create something which is called columella loss, where everything is horizontal and just doesn't look so natural anymore. And pretty much looking at the Fendi lips, starting with the columella, the Fendi columella, if you wish, this seems to be shortened. Equally, in the three-quarter view, as you see here, pre-Fendi, there was a bit of a columella to be seen, and suddenly everything is rather horizontal. So clearly there was some change performed in that area. Let's talk about the distance. The distance being the distance between the nose to the upper vermilion, the top lip. And this distance has been shortened. So again, an indicator for a performance of some sort of a lip lift. The pictures that you find online of Demi Moore's appearance in the Fendi show are all not really great. At least I didn't succeed to get some high-resolution pictures. So you see some shadows under the nose, but you don't know if this is just a shadow or if this is some makeup on top of a potential lip lift scar. My personal belief is different, and I'll come to this in a second, but clearly what we can see is there is a shortening of the philtral distance, the philtral height, meaning the distance between the nose and the top lip, and this again would indicate that some sort of a work has been done on her top lip. The shape, well, before Fendi, she used to have thin lips which were rather flat, and now suddenly she has this kind of elevated appearance with the body being a little bit higher and then the wings just being slightly slanted, something that I call an A-type deformity, something that I see in revision lip lift revision surgery a lot when patients come to see us who had a previous lip lift where only the central part of the skin has been removed and the excision was not going all around the nostrils and the alveoles, and only the philtral part has been elevated. This creates this kind of central elevation where only the body goes up, and by lifting the body only, suddenly you create this kind of A-type deformity because the wings are still pointing downwards. This is something we can see here in her case as well. And looking at the volume, the top lip volume hasn't really changed drastically. I would say they seem to be similar full. However, if you look at the lips of the bottom vermilion, they look completely different. And remember, as I said, that it looks like 2019 she had some filler migration in the bottom lip. Well, it looks like whoever has done some work there might have injected either filler or fat way above the margins and below the natural contour of your bottom lip. You can't really see the vermilion border anymore because there is this kind of a almost step-off deformity with product that has been injected underneath. So all this indicates that clearly some work has been done, actually quite a lot of work has been done, but is this really the result of a traditional lip lift? No, it's not. I think there is something else that we need to talk about, and the technique has been introduced by a plastic surgeon from Houston in 2011, Anthony Echo, It's the upper lip suspension technique, or also known as one of the nose scar lip lift techniques. And what it is, these are the original pictures from his publication. Starting on the picture A on the left, you place an incision inside the nose, paracolumella, and you release the top lip under the skin. So you create a pocket under the skin. You then place a stitch through the nose into the top lip, and you grab the tissue under the skin and pull it up by tightening this stitch. And what you do with this, you lift everything up. These are some pictures, before and afters, of patients of his in this paper, and you can see that there is an increase of tooth show on the left side and also an increase of the lip volume on the right side. One thing that really struck me when I was reading this paper a couple of years ago were, however, the profile pictures, because what I saw back then, and this reminded me again when I was looking at Demi Moore's lips, was the columella loss. You see how the columella is being pushed inwards with this technique because the stitch is being fixated on the septum inside the nose. And if we look at the nose here, you see this would explain why there's this kind of columella loss. The central elevation, because the stitch only goes around the philtrum and lifts this up, and it doesn't necessarily work when the lips are a little bit softer and wider, and this would also explain the A-type deformity. So I believe, and this is only an educated guess, I do not know if this is true or not, I believe she might have been a candidate for a suspension technique. Now, there are two basic principles of nose scar lip lift, one of which we already mentioned, the upper lip suspension, and you really have to carefully choose the candidates. Some of them are good candidates and they benefit from it, but not everybody. The alternative to this is a VY-plasty, and a VY-plasty basically is an incision, a V shape. You lift the incised tissue upwards and you bring the tissue from the sides together and you stitch everything together in a Y shape, and then the tissue from the sides stabilizes the V. It's a procedure that is very often performed on the inside of the lips, and the idea behind this is you're pushing the mucosa outwards. Similar like when you're pushing a rug, it suddenly creates a wave. You can push the mucosa outwards, and by this you increase the volume of the top lips. However, one thing that you will never see with these kind of procedures on before and after websites is the amount of tooth show. These results are always presented with closed lips because what happens is, with a VY-plasty, in particular in the top lip, you lose some tooth show. And if you have a patient with only 2 millimeters of tooth show and you perform a VY-plasty, be sure these 2 millimeters will be gone. So it's something, again, where you have to carefully select the patients. It's a very powerful technique, and I'm using it a lot, but you have to be aware of how to combine it with other approaches or other techniques and who is a good candidate for it. So in her case, another detail that explains the A-type deformity is the tightness of the lips. She always had a thin upper lip, which indicates that it might have been quite tight. And the most extreme version of it is what we call M-shaped lips, so tight that it's almost impossible to change them, even by means of filler. And in her case, in order to avoid this, remember that the volume didn't really increase as the lip was lifted up. You will benefit from a VY-plasty to roll out the mucosa on the inside. In summary, somebody with lips like hers, what kind of treatments could they have? Well, first and foremost, no treatment. She has beautiful lips, she has beautiful teeth, great tooth show, so everybody is used to her look because she hasn't really changed that much over her 20, 30 years in show business. So no treatment, we always have to keep in mind, is certainly an option for anybody. Not only surgical, non-surgical, but no treatment, very important, is the first option of any kind of approach. Secondly, dermal fillers, and in particular a non-surgical lip lift would have possibly benefited in her case. And again, look at Stephen Harris and his techniques. I've learned a lot from his techniques for my VY-plasty planning, very helpful. And if somebody has a little bit worse lips than she does and is not necessarily so prominent, and this is probably the main reason why a non-surgical and a non-scar approach has been chosen to avoid any risks of scarring in her face, she would definitely benefit from a deep pain lip lift, VY-plasty, possibly top and bottom lip, and then a combination of a corner and a wing lift. With this, I want to conclude this presentation. Again, it's an educated guess only. We will post this on our Instagram and YouTube channels. Leave us questions if you have. We are in Harley Street, London, and we love aesthetic lip surgery. Thank you very much for your attention.